Ksenia, how are you? Welcome to the conversation.
Hi, good. I'm so happy to be here. Thank you for your invitation.
I know you're getting blown up right now a lot to get on podcast, so I appreciate you taking the time. The podcast has a lot of different guests from military to doctors to pro athletes. So I do a very quick intro just to give everyone kind of an idea of who we're listening to today. So you are the director of regenerative medicine in Miami. You have a
Yes,
PhD in biology with a cellular biology focus, and you're very big on peptides, IV, and preventative medicine, which
correct.
we're probably going to get into that Western medicine misses the mark on a lot. And you were just on a podcast with Mike Hart, who I followed since COVID times, who I really enjoy. And I thought that the information that you're providing seems to be very balanced and nuanced versus everything on peptides online right now is one extreme or the other. So I'm really excited
Thank
to have
you.
you on. So thank you for being here.
Thank you for having me.
So at the very elementary level, what is a peptide?
I'd like to give an analogy to a child. Imagine Lego, the whole box of Lego, pieces and pieces and pieces. I would say that is our body, our organism. And those little pieces, let's call them protein, those little Legos. Um, I can call them, let's say, an a peptide when I put few Legos together from five, let's say, pieces to 70 pieces, we can call it a peptide. So that's what peptide is. It's a string, and on that string we have pieces of amino acids, and that's what peptide. It's really, really simple. It's really not a complicated thing unless it's a poly. It's a lot of peptides, but one peptide, the peptide that we know as right now, everyone's talking about peptide, those made of 4 to, I don't know, 28 amino acids, so very short chains.
And to my understanding, peptides have been around for quite a while, haven't they?
Yes, yes, I mean, insulin is a peptide. Insulin has been around for what, 60 years,
Right.
not more.
Why do you think peptides right now in the last 2 years have blown up all over social media and the news?
Because of China and the gray market, because I've worked with peptides for the past 7 years. My business partner worked with the peptides. He's a heavy lifter for the past 15 years. So it's nothing new. It's been on the market. Those BPC 157, TB 500 has been on the market for the past 15 years. Um, and right now, again, I'm not sure what's happening with the market. Is it because of China? Is it because of black market and gray market? And influencers are being paid by gray market suppliers, and that's what's happening.
Can you explain what a gray market is?
So we have. Ev- let's start with the beginning. Peptides. Where are they made? APA, the raw powder, comes from China. No matter what, comes from China because China is very good at synthesizing peptides. So China would send, for example, to United States to compounding pharmacy um, raw material, and then compounding pharmacy will take that raw material and finish it. And that the peptide files that we get. Gray market is when the finished product is not finished really. That's my understanding. Again, I can be wrong. Gray market is when somebody will get the powder and maybe manipulate it a bit here from in the underground lab here in the United States and then sell it to population via website. And the black market is directly from the factory in China to the consumer without the middleman. And that's a raw material with all the inflammatory things inside of it, lipopolysaccharides, who knows, and the toxin, heavy metals, you name it, non-sterile, absolutely non-sterile. That's the black market.
Right. Because one of the terms I hear a lot is, oh, people are just taking Chinese peptides and they don't really know what's in it or what they're putting into their bodies. So
Y-
is that is that genuinely happening at a pretty frequent level right now?
Yes, and I have a patient who bought, I think, Rera. online, and then within 2 weeks he turned yellow, and he like, it's like, well, it was not red inside, it was melanotan. That's what happened. You've been
Damn.
injecting. Not 2 weeks, maybe 2 months. But he thought that he was injecting red, and for some reason, they create these protocols, and instead of them injecting once a week, he was injecting twice a week, and yeah, and he got melanotan instead of retatrutide.
So for people that are interested in peptide therapy, we'll say in the States, because that's where you work out of, what is the
Correct.
route for people to take to make sure that they're actually getting purity and high quality peptides versus what you just said that gave that person all of those issues?
You go through the clinics like mine, where we source them from compounding pharmacies that are FDA approved, and they are being third party tested, and they have a special equipment to process the powders. That's the best scenarios.
Because of my history in fitness, I probably get one or two messages a week from some young 20-year-old guy asking me where to get peptides. And again, I'm not, even if I have a source, that's not my position in this world. So I don't say, I'm like, I don't know. And I think that leads to a lot of people like that who want to try peptides to go to Google, type in a website, order peptides. And is that kind of the way that they're getting peptides that are bunk or maybe more risky?
Mm, Yes, that's most. I see that most of young fitness influencers and fitness enthusiasts right now are getting peptides online and not through the clinics because of financial gain, and because as for example, my clinic sells the peptide at a certain price, and online you can buy it 3 times cheaper, let's say. But again, and I
Right.
always say online is because this pharmacy that I work with spent $1 million on equipment to process the powder, and online, not sure who's processing that.
I mean, if you're going to put something in your body, it just seems like such a crazy risk to go to a random website that you don't know anything about or who's affiliated with it and just buy something and then inject it into your body. Like it seems like a crazy concept, but that's happening on large scale right now.
But that's what happened so many years ago with anabolic steroids. Athletes would get them underground also.
Yeah. And
And so
it's,
many health issues that it led to a lot of health issues.
yeah. And for me being well connected in the fitness world, there are definitely people out there that have resources that have legit labs that third party test and make sure it's super legit. But if you're not well connected like that, or you're going to a legitimate clinic, like the chance I'm in my head is like 90% chance that you're going to get something in your body that you probably don't want. Is that fairly accurate?
Yes, it is accurate. And the older you are, the more side effects you will get from those gray market sources. For example, I had mom and a daughter come to my office for a consultation about 2 or 3 weeks ago, and they bought a peptide online and they injected at the same time. The daughter did not have any reaction. Mom got severe allergic reaction. She was taken to the emergency room and was treated for anaphylactic shock.
Oh, wow.
So the older you are, the higher the risk of your immune system overacting towards that foreign thing that you're injecting into yourself.
Got it. So go to a clinic and make sure you're going somewhere legit.
Absolutely. Absolutely. Yes.
Because it's easy for people on the anti peptide side to make those claims, but I feel like most of those claims are substantiated on online peptides that have these reactions versus ones that are like clinically proven. Because when I'm looking at the safety profile of most peptides, they seemed like, for example, like Selenk, right? Like the phase 2 trials in Russia, the risks or side effects or safety profile was extraordinary compared to taking like benzos. So I think there are peptides out there that have really good safety profiles. And I've had friends that have been on benzos and come off of it. Like it's a horrific experience.
It is.
And so when they tried Selang through nasal spray, they got really good benefits of it, and they didn't have these side effects. And one of them stopped taking it, and they didn't do, you know, 2, 3 months of a long withdrawal process. So I think like there's a lot of value in some of these peptides for sure.
Very interesting because C-Lank and C-Max are over the counter in Russia for the past 40 years. I've used
Right.
it when I was a child, when I was at school, never felt anything I've never really experienced any positive or negative effect, but it is over the counter. You can be in Russia and you can buy it in the pharmacy.
Why do you think we have such a hard time here in North America getting drugs or peptides like that that show great safety profiles and pass human trials in other countries, established countries, but they're not getting um, approved here?
It's different approval system, I believe. And again, I'm not so versed in the politics of drug development or how to bring certain drug here. But again, if it's approved in Russia, United States doesn't really care because now it has to be actually approved in this country. It has to go through the same process that it went overseas. It has to go through clinical trials, the phase one, phase two, phase three. It has to, they don't accept others because of the, again, this is preposterous, but it is what it is.
Yeah, I think so too.
But again, in my opinion, if it was approved, okay, not Russia, but let's say Europe somewhere, because cerebrolizin is approved in France, I believe. Maybe I'm wrong, but somewhere in Europe, and they've been using it, but it's not approved here. Um, and many medication have not been approved here, but have been approved overseas.
Got it. The first peptide I want to dive into, which is probably the most popular one in the world, would be GLP-1s. And there's a lot of conflicting information on it. So Ozempic is the only one right now in North America that's approved. It actually just got approved in Canada last week. I was in a Shoppers Drug Mart, and at the pharmacy, there was a sign promoting it, saying that if you're interested in weight loss, talk to your pharmacist. So it's now in Canada. What are your thoughts on? It's a vague question, but what are your overall thoughts on Ozempic?
Ozempic is no longer as interesting as Manjaro, for example. Ozempic is a single agonist. It's GLP-1. It GLP-1 controls your appetite. It also slows the gastric emptying. But tirzepatide would be a more superior drug because it affects two receptors, GLP-1 and GIP. But again, Ozempic, I mean, in my clinic, when Ozempic first came out and was available through the compounding pharmacies, we used it extensively. But now what I see now is those who had severe side effects of it on Ozempic do not have those effects on tirzepatide. So
Yeah,
I would
because
say tirzepatide would be more superior than Ozempic.
it seems like Ozempic is having some pretty horrific side effects for people. And one of the ones that I see the most is loss in bone density. But I'm also curious, and again, I'm not an expert on any of this, but when you look at all these people taking Ozempic and they lose a bunch of weight really quickly, if anyone just did that through diet and they're not exercising and they're losing a lot of weight, like you're also going to have some health issues there too, right? So when people are taking Ozempic and losing a lot of weight, could they not reduce the side effects to like ligaments and bone density if they were exercising regularly?
Well, let's talk. It's not that Ozempic is decreasing your bone density. If you start dieting, if you start starving yourself, you will lose the bone density. You will destroy your health eventually. It's not as there is no side effects. If you look through Ozempic or tirzepatide, the profile, it doesn't really have affinity to go to your osteoclast and start eating them. No, it's your body. It's when you starve yourself. That's what's happening. Any diet, you will lose muscle. With any diet, you will not only lose fat, you will lose the muscle. And if you continue dieting without adding protein or workout, you will lose You will lose the bone. And absolutely, if you are on Ozempic, if you decide to get on that medication, you absolutely have to eat protein. If you cannot eat your protein, you have to drink your protein, and you absolutely have to do the exercise as a weight resistance at least twice a week to preserve the muscle mass, to preserve your bones. Otherwise, it's a starvation. And you see now online, we have Ozempic faces. You know, when you lost all the matrix, the collagen, the elastin, everything left your face, and now you're left with the just the bone and the skin. I mean, it's horrific. But again, that's starvation.
So is that because Ozempic is creating such an appetite suppressant that people are going into like extreme caloric deficits?
Absolutely, and because they can't eat because they feel so nauseous, and it's also dose dependent. You have to understand what is your dose. For example, my dose will be my dose. Like you cannot copy my dose and use my dose to yourself because your physiology is different. We don't know your blood work. It's all dependent. It depends on the context.
So would you recommend then when people, work with someone like you who's qualified in this, start at a very low dose and see how they respond to it before?
Absolutely. It's better to titrate up than down. It's better to start low and just titrate it up every 3 to 4 weeks just to find the right dose. But again, the goal is not for you to starve. The goal is to have a little bit of appetite suppression and to educate that way you will educate your body how to process food. This we all hear about this food noise and what GLP-1 do, they remove the food noise. So you don't have that with time, again, not from the first week, you will train your body, you will eat less, you will have you will acquire better habits, better eating habits with GLP-1s. Absolutely.
Yeah, so it's almost like if people are going to take Ozempic, they need to be really hyper aware of how many calories they're taking in. Because if they're
Yes.
eating, just say they're maintaining their weight on 2,000 calories, and they go on Ozempic and now they're eating like 1,000 calories, and they're crash dieting, then of course you're going to get the bone density issues and ligament issues, etc. So do you recommend people then like make sure that they're tracking their caloric consumption to make sure it's only at like 500 deficit, 250 deficit to do it slowly?
Well, first of all, you do have to have average person, let's say me, I'm 100 and let's say 140 pounds. I decided to get an Ozempic. I should eat about 100 grams of protein a day.
For sure.
Okay, but people don't. So you have to not to track the calories, maybe, but track your protein intake. Protein is what matters for the muscle preservation, for the bone preservation.
Yeah. And any of the literature will say you need to be at least 0.7 grams per pound of body
Right.
weight. And then if you're someone who's like a high performance athlete or bodybuilder, you might get up to like 1.2. Yeah, that makes a lot of sense because I feel like nowadays in society more than ever, we want results very quickly. As you know, we can pull
Yeah.
up Twitter and get the world's news in 10 minutes. So people that are overweight and have been overweight for a long time, they get super motivated to take something like this because they can lose weight quickly. But what they don't aren't realizing is that losing that weight super quickly is just causing a lot of other issues that they're probably going to have medications for. And then you end up in
Yep.
this like vicious cycle. And I'm curious of like what happens when people get off Ozempic. Like, is that something people just can stop cold turkey or
Preferably not. And we have the research that states that in order for your metabolism to reset, you should stay on Ozempic or any other GLPs, maybe for 12 months. And in order for you to get off the medication, you slowly titrate your dose down. In my practice, I use about 3 months to get people off Ozempic.
got it?
So we titrate it down, down, and we get not to the lowest dose, but even lower than the lowest dose for just to give them a little bit of GLPs, and then they can get off safely. If someone decides to stay on Ozempic for 6 months, then quit cold turkey, most likely in 1 year they will regain all the weight gain. And we have the evidence, we have the study proving that.
Yeah, because and the research is pretty clear. Like people who diet within 2 years, like 90% of them just regain that weight. And I'm not talking about bodybuilders or athletes who do it intentionally. I'm talking about the
Right.
average person who's overweight wanting to lose weight. So does the drug GLP or peptide, sorry, does it cause the rebound or is it just typical the dieting down too extreme, your metabolism slows down, then you start eating more normally again because the hunger signals go away and you just put
Exactly,
that weight back right.
exactly.
Yeah,
We
got it.
can we can blame the drug all we want, but it's not a drug. It's our bodies, it's our habits, it's our perception of the food that we eat. And again, GLP-1s, it's not like you're injecting something that you don't have within you. You do have GLP-1 is a hormone, and it releases usually after you, but during your when you eat. But some people have less of it, some people have adequate amount of it, but those who have less are prone to weight gain and this inadequate habits of the food, the way that people look at the food. And
Got
it
it.
all works, through the brain, because GLP-1s, some people, if you see online, many people said that Ozempic um, made me fall out of love with my significant other. Is it Ozempic? Is it really, maybe it's the dosages that were too high? Because it does act on the reward system. That's why GLP-1 I use right now with addiction. If you are an alcoholic or any drug addict and you on that medication. For example, in my practice, many people quit drinking. And even though I did tell them you cannot drink on the medication, but then people came back and they're like, listen, I still drink like once or twice a week. But in 3 months into the medication, I have no desire to drink. I don't find that pleasurable. So they lose the pleasure out of the alcohol. Again, some people say yes, some people say no, but most of the people I see that, and right now, because it acts on the reward on that dopamine circuit, on the same reward system that alcohol acts or amphetamine acts, GLP acts on the same reward system, and that's why it can help people with addiction.
Interesting. I had some significant surgeries through athletics in my career, and I was on an opioid, a powerful opioid, for 7 months, and
Mhm.
it was a moderate dose. I don't share my specific dosages online because I just don't
Of
want to send a
course.
message. Yeah, I just not my style. But I decided to just cold turkey it, and horrific. It's horrific, and it wasn't like I was someone that was getting it from a drug dealer or something. Like this was prescripted from my doctor. And it was so crazy to me because I actually have one of my closest friends, super successful guy, but he succumbed to a 7 year long insane dosages of opioid addiction. And I was talking to him and he was supporting me through the process. And I heard you talk to Mike Hart a little bit about this. So when people are coming off of those drugs, there are peptides in treatment modalities that can help with that process.
Well, yes, not a peptide. It's NAD plus, and that's a cofactor. It's not a peptide. But again, we don't have evidence anywhere in the literature that NAD can help. But if in my practice, it does. And then speaking to other doctors who do use NAD plus in their practice, and they notice the same effect. That and again, when I learned about NAD plus, what it was 6 years ago. And the doctor who introduced me to that, that's what he said. He said, listen, this is what it does, it actually helps with the. And I was like, okay, I'll be using it in my practice. And I see you can definitely see the results. You can measure the blood levels of amphetamines or benzos before and after the infusions, and that's your evidence.
Yeah, because one of the most prominent things that are overused is Adderall and Vyvanse, right? And so I have a friend who has a PhD from Stanford,
Mm?
and he doesn't do anything. He's like Christian through and through, like no sex till marriage kind of guy, like straight edge, doesn't drink nothing. The straightest edge guy I've ever met. I'm like, how do you do this? Because like I was a mess when I was in my 20s,
Right.
but when you even if you look on AI, it'll say like there's not very many withdrawals. You can stop Adderall and Vyvanse cold turkey. But then when you look at real world experiences, you can even go on a Reddit forum, you can see on podcasts, they have horrific experiences coming off of those drugs. It's
Yes,
insane. It's
it
it's
is.
so it's so frustrating for me because I don't know, like it I guess my beef on all of this, and just to preface this, my stepfather's been a surgeon for 30 years. And one of my best friends who I had on the podcast got his master's at Harvard and is one of the most decorated general surgeons in Canada. And it's just so infuriating to me that some people and doctors they need the literature to be 100% just to qualify it, but they don't use their own clinical anecdotal experiences. So I'll give you an example. The doctor that I had on started giving patients for like significant surgeries ketamine for the surgery. And what he learned in his own practice is if he gave the right, I don't know what the dose is, but if he gave the right amount of ketamine for the surgery, he actually, most of his patients now, he doesn't even prescribe opioids to after surgery. Because in his clinical practice, and again, I'm not going to say all the letters beside his name, but he's literally one of the most decorated surgeons in Canada.
Mm.
And again, that was just his own experience in the clinic. But there's no like meta-analysis and RCT, double-blind placebo done on that. So some doctors are like, no, I won't do that. I won't do that. But then one of the best surgeons in Canada who's done, I don't know, thousands of surgeries sees time and time again, if he gives a good ketamine dose, whatever that is for the person, unless it's a very serious surgery, he doesn't give them opioids after, just Advil, Tylenol. And all of his patients report in the first week post-surgery of the acute pain phase that they don't report significant pain over like a 3 out of 10 scale. Do you find that kind of frustrating that like the Western medicine world is like that? Like they
Yeah,
need
listen, I am frustrated with the Western medicine. That's why I don't work. I don't work with insurances. I don't work in a hospital. And when I graduated, I thought I could never work in the system. I really could not, because this is the system designed not to make people healthy. It's just not. It's designed to make uh, not to make you, but it is to make you sick, because you go to the doctor when you are sick, right? And I mean, I'm not registered with any insurances company, and I don't accept insurance in the office, but I do have people who come to me and they do have insurance instead of other primary care providers that would come to me, because insurance dictates when do we need to check for your lipids, when do we need to check to order abdominal ultrasound, when do we need to look at your liver, whether it's fatty or not. I can just prescribe this and they can go tomorrow and check all of that, paying cash to
right,
prevent anything that's happening to them. And regarding the ketamine, I can hypothesize why that's happening, because ketamine acts on BDNF. It resets your brain default network in your brain. And when you come out, your perception of the world that you see completely changes. So the perception of pain changes completely. That's why it helps. I do believe in psychedelics. Trust me, I do. I'm a big proponent of psychedelics.
well, we could talk for 5 hours then.
Maybe
So
next time, but definitely next, if you were
no, no,
to.
no, 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 no. I mean, like I'm just joking. I'm not going to keep you for 5 hours. We agreed to the time. So the the good thing about this podcast, though, is that I don't come with a plan. Like I have themes, but
Mhm.
if it goes in one direction, I like to dive in. And it's interesting because I've now had 5 people on the podcast that had severe PTSD or addictions that have done ibogaine, ayahuasca, ketamine treatments, and it's changed their lives. So I had a guy on, his name's Peter. He's a 23 year old military vet. He's done 6 tours. He's had hip replacements, chronic pain forever, severe PTSD, and yeah, he started doing like microdosing psilocybin, and within like a month, he said on the podcast, like, I thought we were gonna like help my depression, but we crushed it within weeks. And then he did ayahuasca, and a lot of he still has pain, but a lot of his like acute pain is just gone. And it's interesting because like when I look into it a bit more, it seems like it kind of like the neuroplasticity, like you said, of like the BDNF or MDMA in the brain, it
Mm-hmm.
gets so destroyed from trauma and drug use that something like ketamine done properly, not just like
Yes.
you're going to a K-hole. But what I'm seeing in the literature right now is that 6 therapy sessions, and it's like 40 to 80, something like that, milligrams. And after those 6 sessions, if you do the integration work, people are having profound impacts. But then when you hear the word ketamine, I remember I had an ex-girlfriend once, and when I was dealing with my leg issues, and I was super depressed, and yeah, it got really bad, and I was thinking about doing it. And when I mentioned it to her, she's like, "You can't take that. That's a horse tranquilizer. Like that's awful. Like, are you crazy?" But people associate ketamine with me, injecting copious amounts of it and like getting super high off of it. But there actually is like legitimately medical processes
Yes.
for it.
Listen, not only ketamine, you talk about ayahuasca, DMT, ketamine, mushrooms. People think of you as you are taking drugs. There was a study in 2023 released. They analyzed, I don't remember how many, 23 or 25, 27 psychoactive compounds, including LSD, ketamine, psilocybin, amphetamines, cannabis, heroin, alcohol ranked number one in everything. It beat opioids because of social economics destruction, the health destruction, it just the overall. So the score was not just the health, but they took various aspects of it, like social economic, the family destruction of the family, the car accidents, and they found that alcohol was number one offending drugs that is really really addicting, and it destroys your life. And psilocybin with LSD was at the bottom, with zero effect on social economics or the health or family. And again, I've myself know many patients of mine. They went to Peru, they went to Mexico, they did the DMT, they did ayahuasca, and they came back without. I had patients with autoimmune diseases. With one of the patient had I can't even pronounce Schrodinger's disease, where you cannot even cry. There is no tears. Your eyes are constantly feel like you have sand in them. After one session with a shaman in the woods, it was gone.
It's
See
amazing.
how your brain, because you are PTSD, and people with PTSD, you are in a loop. So that loop inside your brain, it just doesn't let you get out. And once you take any of the psychedelics, you can actually get out of that box where you've been sitting for the past so many years. And this is what you see in that box. All you see is four walls. And psychedelics, they help you get out of that space where you can see beyond what it was. I mean, it's unbelievable. I believe psychedelics is the future of medicine. Peptides, yes, but psychedelics, because brain. I mean, I've seen people, very few examples that I have, that people would believe that this medication will help them cure cancer, and they were cancer free within 6 months because they believed it so much that this herb, some Chinese herb, is gonna cure my. Well, I had a patient with. I knew a patient. It was 10 years ago with first stages of ovarian cancers, and she went to the Chinese store, and that Chinese guy, he convinced her that this herb, if she's gonna take it every day, is gonna cure her. Within 3 months, she was cured.
It's
It's
phenomenal.
your brain. We have to research that. We have to research the brain, because this is what actually help us to live happier life and healthier life.
I think you'll enjoy this a lot. I had a guy on named Corey Firth, easily the one of the top five most intelligent humans I've ever spoken to. His brain computing power is just on a different level. So he was actually the first vice president of the Canadian Psychedelic Association,
Hmm.
and he was one of the authors that got MAID. Are you familiar with MAID in Canada?
No.
So MAID is where it's like, what's the word, euthanasia? So like they,
Uh-huh, uh-huh. Yes,
for lack of better terms, they basically kill you.
yes. Yeah.
Um, so what they ended up doing is he listened to, I don't know the number now, I think it was like 900 or 1,000 people, and they recorded the conversations that did
Hmm.
alternative treatments. And they went to the Canadian government and said, like, listen to these stories. So why don't you offer MDMA and psilocybin to people that are going through MAID as a last resort? They're going to go, they want to go out anyways. You might as well try it. And I think it was close to 2,000 people that were going through MAID decided to try it. Not a single one of them went through MAID and ended up going through that process.
I have
And
goosebumps, honestly.
I know, me too, actually. I'm serious. And Corey's like, I don't know, he's very humble, but I'm like, you know that you like saved 2,000 people's lives, right? And he's like, yeah, yeah,
And
yeah. I'm like, you've done more for this world than most people will ever do, right? So I just like the more and more I see it. And the last thing on that, I guess, would be, have you seen the documentary Waves of War on Netflix?
no, no, but I'll look at that.
You should. You'll
Waves
love
of
it.
War.
So
Absolutely.
DJ Shipley, my guy, he was a former Navy SEAL. He was one of the top ranked Navy SEALs. He had crazy PTSD. He was on like 20 different medications to get him through. Like when he was a SEAL at the end, they had him on like pregabalin, Cymbalta, Adderall, like tramadol, like everything just for him to do his job. So his depression and anxiety was so bad and PTSD that his wife was going to leave him. And his wife said, "You need to go do Ibogaine as a last resort, or we're gonna end the relationship." So he did it and changed his life. So he started trying to get other military vets and Navy SEALs with PTSD to go down there. Of course, they don't want to go down there. They don't trust anyone. So what he did, he said, "Listen, I'll be in the room with you to make sure no one would do anything anyways, but they have that safety net, right? That this badass guy is going to be with them." So they actually reached out to Stanford, and it was only 30 people, but they did brain scans of these gentlemen with PTSD, and all their brain scans were terrible, like horrific results. They went down to the Ibogaine treatment and they did brain scans, I think, at like 3 weeks, 3 months, 6 months. And even at the 6 month mark, again, I don't know the terms, but the brain stuff, the neuroplasticity, what they're looking for, BDNF maybe, was almost completely reversed. Like it's so
It,
incredible that they're doing that. And I had a guy on, and I don't know if he's coming on before or after you, so I won't say his name. But this guy is someone who is making like we're talking 100,000 a month kind of money, and he had a wicked cocaine addiction. And he went down there and did ibogaine treatment, but he did it like there are treatment centers down there that aren't just like a shaman in the woods, even like right, like he
of
went down
course.
there. It was in a hospital setting. Like there's ER doctors, there's psychologists, and when he went down there, they they drug tested him every day because they had to make sure everything was cleared out of his system before doing the ibogaine treatment. And he did the ibogaine treatment, and then he said the craziest thing ever was that when he got back home, same environment, no cravings to do the drug, nothing. And he was
Yeah,
an elite power lifter, like totally 19, deadlifting like 800 pounds. He also had, he called it a fast food addiction. People think that in Western medicine that's not possible. I disagree.
of course
But
it's possible. Of course
but
it's
you
possible.
can think of anything.
Yeah.
So he was also like eating fast food all the time because he could afford it. And he doesn't eat fast food anymore. And last time I saw him post, he's down like 50 pounds and changed his entire life. Have you ever done psychedelics yourself, or is it
Yes, I
just
have. Yes, I have, and I've gone to Mexico. I've gone to California. I've seen shamans. I'm not sure if this should be on a podcast. I'm a medical professional, but this is anecdotal. So I had brain tumors. I had two brain tumors in my head. I had schwannoma, meningioma, and I had 9 centimeter tumor in my liver. After psychedelic experience, it's all gone.
Got it.
It's all gone. And I'm gonna tell you what I've taken. I've taken mushrooms, but not microdosing. You're supposed to take large doses once a month. So I would take 3 to 5 grams every once a month,
Got
and then
it.
I would smoke DMT once a month. And within 12 months, it was all gone. And I had two mini strokes because because of those tumors, I developed debilitating migraines, and it was so bad. I even went to Bali for 2 months just to sit with monks when they were praying. I didn't
Wow.
know what to do because I didn't want to have a radiation. And when the surgeon said, "Listen, we cannot remove the tumors because they sit on the nerves. You become deaf, you become blind." So I there was no option for me to remove schwannoma surgically. And I said, "Listen, I'm gonna make my brain just take care of that," and I did. And
Wow.
that's why I'm telling you, I am a big proponent of psychedelic medicine, and I would like to become a practitioner, psychedelic practitioner. Once it's become legal in Florida, I'll definitely do the courses and become a licensed practitioner because I think this is the future. Mental health is the future of everything. We can stop wars with mental. I mean, if everybody would take LSD, there's going to be no war. That's why LSD
No.
was stopped. The Vietnam War, they were all here, hippies, if and I read actually about that. So, and I read the CIA uh, decrypted report where they actually presented a heroin addict brain images to the medical society and said this is what LSD doing to people, and they took the LSD off the streets. And but because people didn't want to go to war. They were taking psychedelics. It was 70s oh, no, when was the war? I'm bad with history. Sorry, I'm a scientist. And that's what happened. If the psychedelics were allowed to continue to exist, there would be no wars. And now LSD is used with USSR in to as a truth serum because you cannot lie when you take LSD. You cannot
Right.
absolutely lie. And I read the reports from the Russian KGB, and I spoke to many people and they confirmed the generals in Russian they used LSD as a truth serum to interrogate foreign spies.
Crazy.
It is
It's
crazy.
no pressure. I hope we can keep that in because I think those anecdotes from established people are important. The I was listening to a podcast with Andrew Huberman, and he had a guy on named psychiatrist on or whatever the term is, named Keith Humphreys, and this
I
guy's
should
like a
listen to I should listen to Huberman because I really have no time with my practice and with everything. But I want to listen to Huberman's. Yes, go ahead.
no, it's all good. And Keith Humphreys is like a super well established researcher and doctor from Stanford, and he was not to go all into ketamine again, but he was the one that I actually heard about ketamine and how it had rampant regeneration of the BDNF. So it's not just like it's like this hippie thing. Like one of the top
Exactly.
doctors at Stanford, which is one of the best medical schools probably in the world, is now using it in practice. So I think there's a lot of misinformation on it. I do think like you got to be smart about it. Like you got to make sure you're
Of
going to the
course,
right
of course.
places and being
But
mindful of it.
there is no lethal dose of LSD. You cannot overdose on LSD. There is no lethal dose. And right now, LSD is being almost integrated into the psychiatric world. I think they trying to remove the hallucinogenic component from the molecule itself because
Mm,
and use LSD in psychiatry. Right now, they are using psilocybin already in Colorado, California, few other states. They are using 5-MeO DMT as a nasal spray. They're using MDMA, so it's being introduced. I mean, ketamine is now legal in Florida also. Psychedelics are coming back. And Ibogaine, if you heard the RF Kennedy, he signed something with Ibogaine that Ibogaine will come to to medical practice. I mean, something with mental health.
Yeah, and the
It's
safety profile of them compared to SSRIs, it's not even comparable. And like
of
I'm
course.
I'm again, when people listen to this, if I say 40% and it's 42, they're like blah 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 blah. Again, I
Yeah.
might get the exact number wrong, but like SSRIs don't work for like 40% of people. And
No.
now they're showing long-term data is coming out of the horrific effects that these drugs have. Like there was
Yeah.
a woman that was on Chris Williamson's podcast recently, and she went on SSRIs, and she lost all sensation in her clitoris and lost all sex drive. It's just, and she was 23, 24. Like, so you can imagine being that age and wanting to have kids and losing that. Like, it just seems like,
And not only, I mean, it's a very known side effect of antidepressant medications. Yes, there is no sex drive. People don't want to have sex. Just when gynecologists put young girls on birth control, they lose all the desire to have sex. So same here.
yeah,
SSRI,
it's,
and they blunt, and now people. I took SSRI a long, long time ago, when I had moment when I was depressed, and it just blunted me. I wanted nothing. I had no desires. I had no desires to be happy. I had no desires to be not happy. I was like indifferent, in indifferent state for almost a year. I was like, like a zombie. You sit at the restaurant and you can't even decide what to order because there's nothing communicates within. The response is so blunted. I am against SSRIs and SNRIs. Yes, I know I will be punished for this, maybe hopefully not. It does help some people. We have people with schizophrenia and bipolar disorders and so many other disorders. But look, even I speak on my page, on my Instagram page, about perimenopausal or menopausal women that are put on those medication and SSRI because nobody wants to deal with their declining estrogen and their declining progesterone, instead of actually analyzing their hormones and trying to stabilize, balance the estrogen and progesterone exogenous. They're just put on SSRIs. They given antidepressant to manage perimenopausal symptoms when it can be managed with hormones. The hormones that they are losing because of the age.
yeah,
I'm very frustrated about that.
yeah. I mean, especially you being a woman, like that's got to be even extra infuriating. Yeah, it just seems like, I don't know what it's like in the States, but in Canada, you get a 10-minute, maybe 15-minute appointment with your doctor.
Same
You're
here.
not, it's like you're getting, it's like you're reporting symptoms of depression and anxiety, and within one doctor appointment, no blood work, anything, you get put on this drug. And what's interesting is that a lot of the really good clinics right now, like the one in Texas called Ways to Well, I believe, the guy was on Rogan a bunch of times. But when you go to those clinics, like the first thing that they do is they do like a 40 plus blood plant panel breakdown of what's
That,
going on
that
in your
that's what I
body.
do. That's what I do in my practice. I have 80 actually items on the blood work that is required in my clinic, and I spend at least 40 minutes with each patient. If it's a new patient, I can sit with them for 60 minutes, even more if needed. I never spend 15 minutes. It's never in my practice. This is exactly what I do in my practice. I spend time, I listen to them, and they bring blood works for the past 2 years, and we try to analyze everything. And kudos to Texas, I mean, doctor. It's needed because patients wants to be heard
Yeah,
and not just look at the numbers.
when you go there, it's expensive, but it's worth it. Like if you go there, you do the blood work, but they also, I forget what it's called now, but they also do that really like golden standard brain scan. They do a full body MRI. They have a bunch of different doctors on site. So they give you like an entire comprehensive plan based on like gold standard testing and the blood work. And it's almost like, and again, I think there is a very good place for Western medicine in some context, but it's almost like it's backwards. Like that doesn't happen in Western medicine. It's you go there, you report symptoms, you get on these drugs, versus let's look at what's under the hood, what's going on. And again, when I did blood work maybe 2 years ago, when I was having issues with my leg, so I had bilateral popliteal or popliteal artery entrapment syndrome, which is
Oh, wow.
super
Painful.
rare. super rare, super pain. And then when they cut me open, they also realized that I had tibial nerve entrapment as well.
Ooh,
So I had tibial neurolysis. It's actually one of the first or one of the few surgeries that was done in Ottawa Vascular Clinic, which is one of like the top five vascular institutions in Canada. Ottawa is our capital city of Canada. And that surgeon that I had, who was great, it's the first surgery for the artery entrapment that he saw that also had tibial nerve entrapment. So when I did the blood work, I remember I got the paper and I sent it to my friend who's a sports physiologist, and he's like, "They're not even testing your free testosterone. Like they're not testing your." And I was like, "Oh, really? I had no idea." So he's like,
good. Yeah.
so he gives me a list of like 30 things. I go back to my doctor. I'm like, "Hey, I talked to this guy, showed him who he was, and he wants me to get this tested." My doctor's really great about that stuff, so she's like, "Sure, we'll do it." But I forget she was testing one part of my testosterone, but it's not even like the right one to test for. Like it's not she didn't test for like free testosterone. She didn't test for like even like PSA as a man. Like you should be getting that tested probably
Of
yearly,
course.
right? Like,
Absolutely, yes.
and it's insane. So
And you
so
do need
yeah.
your testosterone for healing. If you're, especially after the surgery, if your testosterone is down at the bottom, the healing will take longer.
So getting into testosterone because that's something I wanted to get into. So I'll give you a quick little story here. I was at a local gym, commercial gym recently, and there was three kids. They're probably like 17, 18, and they were all in the same like change room stall, and they were talking about it, and they were taking testosterone. And I think it's pretty criminal for, or bad, not maybe not criminal, but I think it's pretty horrific for men at a certain age range to take testosterone. Would you agree with that?
Absolutely. Of course. I mean, if you're 17 years old with no hypogonadism, that's the diagnosis where you are qualified for testosterone replacement, you are at your peak. You are all your hormones are at their natural peak. Adding more testosterone, not necessarily better. No, I am against that. Again, and I'm against supraphysiological doses of testosterone that I speak on my page. But bodybuilders, again, bodybuilders can do whatever the hell they want. But as a medical provider and understanding what can exogenous testosterone do to you, more is not necessarily better, especially with testosterone. I am for physiological doses. Again, if you're 40 and you test your testosterone and it's within the range, but it's on the lower end, I'll absolutely give you a trial. See how you feel.
And that's around like 300 or 400, right? Like the lower,
No, that's very low. Again, how it depends how old are you?
right? So like, it's hard to, for like just like an average 30-year-old male, like what would you consider like physiological ranges? What would you consider to be like high, medium, and low?
If let's say if you're 35, your physiological range should be probably around 600. We can get with testosterone, exogenous testosterone, with the small doses, we can get you to the 1,000 or 900. But again, total testosterone is not the testosterone that your body can use. We have to look at the free testosterone. Free testosterone is a free hormone that is available for your body to use to build whatever that needs to be built. That's why looking at free testosterone, and again, ranges are so vast. Probably Canada have different ranges. Russia, in United States, it's what from 5 to 20. 5 would be the lowest number, and yeah, 5 is very low. It's very low. But again, if your testosterone at 7, for example, let's say a healthy man comes into me with their total testosterone of around 700, but their free testosterone is 5, they are qualified for testosterone replacement therapy because their testosterone is not it's bound. It's not total testosterone is not what your body is actually can be using. But also we have to look at your SHBG, sex hormone binding globulin, that binds the free testosterone. Could we try and unbind that and not to give? Yes, we can try, and we do that. Can we try and not give testosterone but give something like enclamiphene or HCG to stimulate your own production of testosterone? There are many options.
So what are some signs for just say between 30 and 40-ish for men that their testosterone is probably too low? Like, what are like symptoms without getting testing, just symptoms in their day-to-day life?
Well, symptoms will be fatigue, inability to gain more muscle if you do exercise, if you go to the gym and you don't see the result, that could be testosterone. Again, if you go to the gym and your recovery is very slow, that could be low testosterone. Moody, that could be also low testosterone. Um, Depression. I mean, men with low testosterone are prone to depression.
Right. Yeah, it's interesting because the last time I did my free test, it was 564. And my background is in ultra endurance. So a normal training week for me would be like 12 hours on the bike, running 70 kilometers, like super, super high volume training. And obviously, one of the downsides of high endurance training is your testosterone can get pretty low. But 564 for the amount that I was training is actually considerably good. I mean, a lot of endurance athletes get really low. But I always found for me when I did testing and they're like, oh, yeah, you're good. I'm like, but you're comparing that to the average man. And no offense to other men out there, but with my factual performances in athletics, I'm not average. So I just is that just me being egotistical, or is there any truth to that?
It's true. It's your physiology. That's how your body react. That's how your body react. Not everybody can feel. Again, not everyone with testosterone at free testosterone at 5 point something will feel depressed. If your body is if your body responding well to that, that's your physiology. That's
Right.
appropriate. But again, if you don't have the symptoms,
So if someone is at like 500, 600, and they don't have any symptoms, then it's probably not worth taking anything, right?
but again, no symptoms, you may just get used to those feelings and you think it's not a symptom, right? A man who is with the low testosterone for years and years, they think it's a norm. And so
Right.
many times we would give them testosterone, let's say 60 milligrams a week, and they were like, wow. And I thought I felt normal. This is how I'm supposed to feel. I am back to my 25-year-old. I'm full of energy. I wake up with an erection and I want to do something, this, the they want to live life. But
Something
a lot of people would say I have normal testosterone, but again, normal testosterone, it's not normal for you, but you got used to the feeling of this being normal.
is waking up with an erection in the morning um, a good indicator for men that their testosterone's probably at a healthy level?
Yeah. Um, Not only erection, see, we can take just one value and assign it to the whole thing. Erection, yes, but we have to look at other things. How long does the erection last? If you're going to have an intercourse, how long do you last? Do you have premature ejaculation? Erection itself is not an indication of high testosterone. It can go up and it go down within minutes.
Right.
It's
So there's a lot of confounding variables there.
yes, exactly.
And then, so when you're getting men on testosterone, you mentioned physiological. So are you giving them like the smallest enough dose to move the needle, and then you're testing them every
Yes.
so often and seeing what happens?
Yes, correct. Usually we look at their numbers, and let's say if their numbers is really, really low, like at 100, and free testosterone is at 2, we'll give them 100 milligrams a week. And in 8 weeks, we will retest their values. And we'll also look at their estrogen and DHT, because testosterone, exogenous testosterone, if your body is able to take whatever it can take. For example, um, let's say your body can only take 50 milligrams of testosterone and we're giving you 80. What happens to the other 30? The other 30 will be converted either to DHT or it will be aromatized to estrogen, or it's going to be estrogen and DHT will go up. But I see both values go up and it's actually super physiological doses.
So
And
should
we have to look.
people, so should men also then, when they're taking testosterone, assuming that they're doing it properly through a qualified clinician like yourself, should they also be taking something to make sure their estrogen doesn't get too high as well at the same time?
No, you only take something for estrogen if you overdosing on testosterone and your estrogen keeps going up. Your estrogen will not go up if you're injecting your physiological dose.
Hmm, got it.
Your
And then,
estrogen goes up when when you're using more testosterone that your body can metabolize.
so when people are going on TRT and staying within physiological ranges, does that mean they have to be on it for life?
Yes,
Got it. And does that affect fertility?
yes, absolutely.
So,
When we give you testosterone, your body is very, very lazy. Your natural production will halt. And for that reason, we have other medication. For example, if you're young, again, I don't get many young, but if you're young and have no children and you want to have children, when you decide to, we will decrease testosterone and we'll increase gonadotropin. We will give you HCG or we'll give you enclamophene to increase your own production, and you will be able to restore that
got it.
function.
Because sometimes I see professional bodybuilders that are well known and even in the middle of their careers or towards the end, they have kids. And I'm thinking, like, how is that possible? Because those guys are, we're talking, they're taking 500 to a gram of testosterone a week. So I guess that's kind of the
They
protocol they're
stop.
doing.
They stop. Yes, they stop for 3 to 6 months to conceive a child.
And they're probably taking those three, I can't pronounce them, but the three um, drugs or interventions that you just mentioned.
Yes, too. It's HCG. It's a human chorionic gonadotropin. It stimulates your balls. I'm sorry for my French to produce testosterone via LH, luteinizing hormones. Or we can, or and either not only one drug, we can give you two, and we give you enclamov, and that works through the brain by stimulating your through the brain the axis, gonadal axis. It stimulates your of FSH, two
Got
different
it.
hormones. It's also again, it's all individualized. We have to look at the blood work. We have to test your LH and FSH before we assume what exactly we're gonna give you.
And one topic I wanted to dive into, because it's so outside of anything I know about, is birth control. And I just keep hearing horror story after horror story after horror story. And I feel like maybe similar in precipice to SSRIs that they're overprescribed and leaving young women in a state they don't want to be in. Is that kind of a fair?
Yes, birth control can play a beneficial role in patients with certain conditions like endometriosis or PCOS, or those other um, categories of women. But if you don't have any of that, again, you also stop production. If I'm gonna give a young girl a birth control, your body will think that she's pregnant, and she will not produce a specific hormones to get pregnant. This is
Right.
to trick your body. So honestly, when a woman takes birth control, her body think that she's pregnant. That's what's happening.
Yeah, because
Imagine that.
is it, yeah, it's crazy. So what kind of other negative effects does birth control have for, we'll just say young women in the sense of like prime childbirthing years, just say between like, 20 and maybe 30? Like what other negative side effects can birth control have for people or women? Sorry.
Dysfunction of the hormonal dysfunction, premature. Um, you can even get into the premature menopause. Not sure what's the mechanism there, but not gonna go into that. Need to read more studies. But most of the time, it's severe depression. It is a decrease of your own production. And then, in order for you to restore the cycle after you finish the birth control, some women, it takes years and years to restore the
So,
cycle.
so for perfectly healthy women and their blood panels in that age range, then you would probably not advocate or advise them to take birth control.
I don't advocate or advise birth control. We have the coagulation. We do have a lot of side effects. Blood clots is one of those. Depression is one of those. There's, if you look at the, insert, it's a lot. It's a lot there to read. Sometimes again, it's necessary. With PCOS, for example, those women, they produce a lot of their follicles mature very, very fast, and birth control halts that. It just stops the maturation of your eggs. But for the healthy woman who is not on birth and wants to get birth control, I would suggest exploring IUDs. We have a copper IUD that is non-hormonal, and I used to have a copper IUD for about 15 years, and I was on birth control at one point, but then getting more and more into science, I decided I don't want to expose my body to those hormones.
Got it. Yeah, I've had four serious girlfriends in my lifetime, and one of them was on an IUD, and the other three were on birth control. Again, super anecdotal, but from my perspective and all the conversations we had, the IUD, the girlfriend that had an IUD, seemed to be a lot better off than the other three that were taking birth control. And I was always trying to advocate for them to get off of birth control. But it seems like doctors nowadays, like SSRIs, if you go to your doctor and say, I want birth control, they'll just prescribe it.
Yeah. But again, birth control is it will stop all your hormones, production of all your hormones. So there is no desire. The libido is down. So there is no if a man and a woman decide to get together, live together, get married, and then she's on birth control, she doesn't want to have sex. There is no desire because she has no estrogen. She has no testosterone. Everything is inhibited to the point where the desire hormones play a role in your libido and your desire.
Right. So then the male could then obviously get in his head about she
Yeah,
maybe cheating or just not sexually interested in him anymore, which is going to
exactly.
create a downward spiral. And yeah, I'm not an expert. I just think that, the further we get away from nature, um, potentially the worse it gets. And there are safe sex practices that you can do with your partner that um, can mean that you don't have to be on something that's going to alter your hormones. Because again, we've seen it in even in the States, like young women with RFK and stuff sharing stories in Congress or the Senate of horror stories of what it's done
Yeah.
to them and wreaked havoc of them. And um, I mean, now there's lawsuits coming out, which is not crazy in the sense that it's good that they're happening, but it's just crazy that we're in a society now where women have been advocated for by doctors to take things that alter their hormones and they have crazy side effects, and now they're filing lawsuits and some of them are winning. So maybe that'll be enough to kind of shift the pendulum a bit. What about Western medicine do you like?
Mm?
What about Western medicine do you like? Like what parts of it?
What about Western medicine? Um, well, we have great diagnostic criterias. If we do diagnose it early, we do. Um, I again, I can't answer that question right now. For some reason, my brain doesn't want to go there. Hmm.
Well, when I
What
asked,
what do you what do you think?
yeah, and it's all good. When I asked the surgeon that I had on my buddy I was telling you about, um, his answer was uh, acute care. So you're
Yes, yes.
like
All
you
right.
like
Mm.
you're going to the ER and you're septic. Like yeah,
Yes.
you need an acute antibiotic and an IV to get that under control. Or someone breaks their femur. Yeah, sure, maybe fentanyl and medications to get them out of that acute pain state. Um, uh, Anesthesiologist like putting people under for surgeries. So his perspective on it was the acute care um, processes for like viral infections would be things that he promotes. But I'll tell you a quick story. It's very interesting. I've said this on the podcast probably too much, but one of my close friends, he's been on the podcast multiple times, Adam Jansen. he's one of the best power lifters on the planet. And he got ulcer colitis.
Mm.
And so the GI surgeon put him on prednisone. And his was so, and he said this, so I can say it. He was like, he was like shitting blood like 20 times a day, super dizzy, like it was awful. And when he went to the doctor, they put him on prednisone, which helped his ulcer colitis, but it created so many issues in his hips and his back. And he's
Yes.
26 in the prime of his life. So he just did his own research and he literally used Reddit. And he got off all the medications. He only ate one thing, one meal. That's it. And it was like all organic. It was chicken soup. So chicken broth, peas, carrots, peeled chicken. That's all he ate 6 times a day. He removed anything like Monster energy drinks, supplement powders, and he switched his water to 100% demineralized water, and he took nicotine. So that's all he consumed. And he did that for about a year, and he's had complete 100% remission of ulcer colitis. And then when I had the GI surgeon on that I was telling you about, I said, what would you do if this patient came to you? And he said, oh, I would recommend like lifestyle habits and diet first. So if you go to one doctor, you get put on this aggressive anti-inflammatory, but you go to another doctor and he's going to say you should try diet and what he actually did. But if
Yeah.
he ended up, but you only, I always get the word wrong, is tierate or titrate. If you go to prednisone, the next, when that stops working, you go to Ibalogics and the IV and it gets worse. This isn't a normal person. This is like one of the highest performing athletes on the planet. So he makes a living off of that. He can't
Yeah.
go that route for his ulcer colitis. We put the podcast out. It was the second biggest podcast I've done. And he got dozens of messages from athletes with ulcer colitis. And they were like, we had no idea. We just thought we had to go on prednisone. Again, he was like, I'm not a doctor. You know, if you experiment with that, I don't want any responsibility for the outcomes. But it created a bigger conversation in that athletic world of, oh, there's actually a different answer potentially than just prednisone, Ibalogics, and your career's over.
Yeah.
And the doctor that I had on, I mean, his brother's a naturopath, but he's very big on lifestyle habits. So you'll like this. This is pretty crazy. I did this recently. I've had some like all the medications, so I'll just say them. So when I was working my last job, I had like a decent leadership role in the restaurant industry, but I was on my feet all the time. And you can imagine with artery entrapment how horrific that would be.
Yeah.
So in order to get through the last 2 months before surgery, I was on Vyvanse, Cymbalta, pregabalin, and hydromorphine. Those are three very powerful psychoactive drugs.
Yes.
And I was just getting hopped up on all this stuff. And I don't regret it because I was in so much pain. I needed to make a living, right?
Yes.
But it created a lot of issues in my gut where I would get bloated from just drinking water. And he's been bugging me for a year to do a 72-hour fast. And I'm like, oh, I don't want to do it. I don't want to do it. And eventually I said, fuck it, I'm going to do it. So 2 weeks ago, I swear to God, I documented it, but I did a 72-hour fast. So all I did was water with salt. I did like pure nicotine pouches and
How many milligrams?
a nicotine. I was probably at like 20 milligrams a day.
That's a lot.
It's a lot, I know.
3 milligrams is a therapeutic dose for your brain.
I know. I get the problem with me, right, is I'll tell anyone this, is that I have just genetically, like I have an addict's brain.
Mm.
So earlier when I mentioned all the hours that I trained, that's just my life. So like if I do something, it's always to an extreme. So I'm not going to get into running and endurance and just run a couple 5Ks. When I started running, actually, I followed one of the Olympians, females, Des Linden in America, and I saw her Strava, and she would run 16 kilometers every day. So me being psycho, I was like, I'm just going to do that. And after a month, I was on a run and my legs just, I can't even explain it really, but my legs just stopped working. I was in so much pain. They just stopped working. Like I could walk, but like if I tried to run, it basically like my nervous system shut me down. So I'm just like that kind of person. So knowing that, I have to be very careful, right? So if someone, a doctor's like, you want opioids? I'm like, now I'm like, no, because I know that like I just have an
Yeah.
addict's mind, right? But yeah, that's all I did. And since I did that fast and I did a proper integration of bone broth, dilated juice, and like really just slowly introduced fiber back into my diet. So Greek yogurt, sauerkraut, psyllium husk, like pure psyllium
Mm-hmm,
husk,
mm-hmm.
and increase my fiber intake. And today I'm sitting here with no GI issues
Awesome.
off a 72-hour fast. And people like myself, I thought it was some like bullshit hippie thing. But there's actually a guy named Dr. Longo. He's at a USC, and USC is the number one ranked geotology, I think the word is, um, facility, if you will, in America. And he's the director. So it's not like it's some hippie thing. It's literally the best scientist maybe in the world on this topic. And the fasting, it was crazy for me because on the second day, I woke up at 4 a.m. I'm usually up at 8,
Mm-hmm.
and I had more energy and mental clarity than I've had since I was maybe 21.
That's
And
incredible.
I called my friend. I'm like, what's happening? I haven't eaten in 48 hours, and I feel like I can go run a marathon right now. So the first 24 kind of stuff, but it's all perspective. I mean, I
Yeah.
made a joke on my Instagram like I went through opioid withdrawals cold turkey. So a 72-hour fast isn't that hard. But my point, I guess, on all this tangent that I'm on is there are like natural, and fasting's been around forever.
Yeah. I've
And
entertained it too.
and so my friend who's a doctor in Western medicine, he actually prescribes fasting to a lot of his patients. And the results are even 48-hour fast is tremendous. And it's really not that hard to not eat for 2 days. It really
Yeah.
is like there's challenges, but if you do it on 2 days and you're off work, like
It's the mental block that you
it
have to
is
eat. But yes, I've done fasting and I've done ketogenic diet where for months and months, and I've done 72-hour fast. And I think mostly why people are scared of it, it's mental. It's mental block that you have to have food. You have to have something to eat. And no, you don't. For 72 hours, it's very safe. We do
very
have the studies, we do have research that autophagy, that when you fast for 72 hours, your body will eat some of the bad crap that is accumulated there.
what's the word? It's like au-
Autophagy,
auto,
autophagy, autophagy, autophagy,
yeah,
autophagy.
yeah, and that becomes rampant. When I looked at
Yeah,
like Dr. Longo's work
yeah.
at like 72 hours, so he has like cancer patients that have done lots of fasting protocols that have had like great results. Um, People will crush me if I don't talk about BPC 157.
Yeah, right. Let's
So
talk about.
I don't know about beef with it, but like I have concerns about it. So
Mm-hmm.
obviously there's not very good human trials. And then the pharmaceutical company, Lilly, whatever that one is,
Eli Lilly.
they,
Uh-huh.
yeah, they did a trial on it and the half-life was like 2 minutes long.
Yeah.
And so like what are your thoughts on BPC 157?
Well, everyone's is it's not FDA approved. Okay, I don't really care much about FDA. I do care about the studies because all the BPC research comes from one lab and it's in Croatia. Um, but it's very interesting molecule. It was isolated from your gastric juice. It's a huge, it's again, BPC 157 is just 15 amino acids. That's a fragment of the longer protein that is found in your um, stomach. Do I see results with BPC 157 with the patients that take BPC? Yes, I do. Most of the time, we do see results. Um, we do see results with some of the musculoskeletal issues. And I do have arthritis, and I have taken BPC myself. I did notice result. I did notice less pain, but again, it's all anecdotes, right? We don't believe in that. Not Western medicine don't believe in anecdotes. I believe, and I do believe in real world evidence, and I do believe in that because we do have. I have a substantial patient population who are athletes who take BPC for recovery, who have great results. Not everyone. I can say that 100% of them will have great results, but majority of them will. And I do have patients who have absolutely no results, but
Do you
most of the
think
patient will have results.
do you think a good portion of those that get good results is placebo?
Could be, absolutely. I don't dismiss that.
Yeah, because that's something I find too in the medical world that isn't factored in a lot is placebo.
Listen, placebo effects plays huge role that your brain, think the brain. Can BPC be dangerous? I don't believe so, especially if you get BPC from the reliable source. It's just 15. It's very short. It's not very short. GHKCU is for amino acid long, but BPC is 15. I mean, but we know the mechanism. We know that BPC, and with uh, again, even if an animal model we would see some cancers lesion, we don't. We do have extensive rodent research, and we do not see any negative side effect.
Got it.
People are scared about angiogenesis, that it can create um, something not favorable. Can it? We don't know, but we do know that we have two mechanisms that drives angiogenesis. There is a pathologic angiogenesis. That's how cancer grows, or any benign or malignant tissue grows. It's with angiogenesis. For example, there is a I had a liver tumor that was angioma. It was made of the blood vessels. So that's angiogenesis. That's what drives that tumor. Um, but I do not believe that BPC can produce pathological angiogenesis, but we do not have research for me to say I do not believe mean absolutely nothing. Now another doctor may say, hey, well, you're gonna give BPC 157 to patient with diabetic retinopathy. It's something with the eyes. And if that promotes angiogenesis in the eye, they will become blind. Absolutely, they will. Yes,
Got it.
if BPC will add, but we don't know again. But also, if you look at the world for the past 10 years, millions of people got on BPC. And I'm not afraid to say millions. I think it's millions. If there would be significant negative effect, we would hear about that.
I agree. I also think that it should be ringing alarm bells for Western medicine that so many people are taking peptides. And what I mean in that is a lot of people are in significant pain and different varied symptoms and issues, and they're not getting the results that they want from traditional medicines or more traditional medicines that are prescribed and FDA approved. And so they're trying quote unquote alternative ways to try to fix that. And that should be a big enough sign for Western medicine, I think, to be like, there's a problem here, right? One topic I was interested in too is so Dr. Michael Eisenberg, he's the head urologist at Stanford. And he actually recommends 2.5 to 5 milligrams of Cialis for middle aged men.
Me too. I do recommend that too.
And why do you recommend that?
Because it promotes dilation of your blood vessels, and also there's a nitrous oxide plays a large role, the release of nitrous oxide during the when you take tadalafil. Usually it's 5 milligram tadalafil. I do give 5, not 2.5. Many not only middle age, I mean 40-year-old men who would take 5 milligram tadalafil before workout will have more results.
Yeah, because I think when people hear about, for instance, tadalafil Cialis, they think about erectile dysfunction. But when I was listening to a little bit of Michael on a podcast, he was saying that it helps with like the blood flow, I guess, to like the pelvic floor region and soft tissues to the prostate.
But not only blood, but 5 milligram, not only pelvic floor, even your heart. That's why
Right?
you are able to do better cardio with 5 milligram of tadalafil.
Yeah, and also why it's a banned substance. It's a P considered a
Yeah,
PED for
yeah,
endurance
yes,
athletes.
yes, yeah,
And I and
exactly.
I always tell people, being so involved in athletics, when I was an athlete, I never took anything, never have, during that time. But since then, I've experimented with a couple of peptides and low dose. I just say Cialis, but tadalafil, and just as an experiment. But it's very interesting that Cialis has so many more benefits than just erectile dysfunction in men. Like it's pretty incredible what the results are right now.
Exactly. Yeah, exactly.
One of the big ones that I'm seeing is for treatment resistant prostatitis in men.
Yeah, yeah, absolutely. And that's there is a mechanism. Again, if you're if you bring more blood flow to the prostate, your body will get rid of the infection faster.
Yeah,
It is very beneficial. And it was again, I did during podcast with Mike, I did say it was initially it was given with to patients with prostatitis and with for BPH because of the blood flow. Increased blood flow fixes a lot of things. Just like
exactly.
BPC, it increases the blood flow to the injured area. BPC and TB 500, that's the mechanism to heal it faster.
And we've known that for years, right? Especially as like a runner. If you do
Yeah.
a like a 30K hard long run, doesn't matter how good you are in experience, you're going to be pretty sore the next day. But actually going out for a walk or a light run will improve recovery than not running at all, right? So we know that pretty clearly. And
Yeah.
it's interesting because I'll just share, I don't mind. I'm a weird case with medical stuff, but when I was 15 or 16, I had prostatitis, and obviously that's super rare at that age. And I did antibiotics and it worked. Prostatitis came back in my when I was 30, and PSAs were elevated, prostate was a bit swollen, and I was treatment resistant to the antibiotics. But I also just didn't like antibiotics because of what the damage it does on your gut. And it didn't just this my didn't make me feel good.
Yeah.
And so yeah, when I heard about the Cialis thing, I was like, I'll try it because I'd rather give that a shot because it seems like it's a safer medication
Well,
than antibiotics.
we can't really say it's a safer alternative if you already have prostatitis. If it's bacterial prostatitis, I do not believe that 5 milligrams tadalafil will treat that. If there is a bacterial infection, antibiotics are needed. But tadalafil is very preventative for you to get prostatitis.
You shook your not maybe not shook, but you tilted your head when I said antibiotics and the issues on the gut. Do you not?
Yes, of course. Yes, there is issues. It's absolutely there is issues. I'm not a proponent of antibiotics unless it's really, really necessary.
Do you know who Ryan Garcia is?
No, don't know
No,
any
it's fine.
people.
It's fine. Most people wouldn't because he's the best Brazilian jiu-jitsu practitioner of all
Oh,
time. He's 29 and just retired, and the reason is that he was getting staph infections a lot, and
oh,
so in order to train and compete, he was just taking antibiotics, powerful ones, for years. And now his gut is so destroyed and his health is so destroyed. And as you mentioned on a previous podcast, but the gut is like the second brain, right?
absolutely, absolutely.
So and I'm not saying maybe his case, but when people are taking medications and prescriptions, like even Advil has a bad effect on the GI.
Yes.
What do you recommend for people in combination with lifestyle habits and kind of the treatments that you're using to help repair the gut?
Fiber. I take loam. I bought it off the internet, but again, it's very soluble. It's you put it in a cup and it just disappears with water. But any fiber, it should be very beneficial for the gut. Anti-inflammatory diet. If you eat less processed food, I mean, the diet is a very very important thing because people People come to me and they want preventative and they want longevity, but yet they don't want to give up the ultra processed food. Alcohol is a main offender for the gut, main offender. Ethanol. I would say the diet would be number one. You should watch what you eat. You should stick to whole foods. You should not eat ultra processed food. That's what destroys our gut.
Yeah, I agree. Yeah, and that's the exact same thing that the GI surgeon that I had on said. I was thinking he was going to start talking about medications, and he was like,
There's no,
he's
and
like,
I can't even say take probiotic or prebiotic. I would say take sauerkraut, take Greek yogurt, take something fermented, drink kombucha, something natural that is not in a pill.
yeah, because every morning I have a plain organic Greek yogurt, and I have some local maple syrup. I put some Sicilian husk in with some
Mm,
blueberries, and then with my dinner, I always have sauerkraut and kimchi.
okay.
And I, because of my ultra endurance, when you're eating 6,000 calories a day and you're on the bike all the time, your sugar intake and processed food intake is very high because you're just trying to get calories in, and it's really hard to do that with just chicken and rice.
Of
So
course.
I had a really bad habit of just snacking on candy all the time. So I removed that, removed the candy, added those things in, and eat mostly whole foods plus the fast, and like my gut health. And I noticed the direct correlation with my mental health as well
Yep.
and cognitive
Yep.
function.
Of
Got
course.
it.
Yes, exactly.
As we're wrapping up here, what peptides do you think? I know you get this question a lot, but what peptides do you think are over promoted and not as useful as advertised?
What's Mat C probably would be because it's now being used by young people, and I believe that Mat C should be used with people with metabolic dysfunction, with someone who is obese with metabolic dysfunction, and not for the young, um, who is 20-year-old and want to get ripped at the gym. And you can't. Not C will not get you skinny. Really, it's the drug that works through a different pathway. It's not fat burning pathway. It's the MPK activation, which reroutes the metabolism and energy use. So I would say over hyped peptide would be MAT-C, would be epitalon. Mm, Yeah, those two I would say. But everybody's taking now GLP-1. Now GLP-1 is like everybody is on GLP-1, honestly. Rara, underground Chinese Rara, everyone's using Chinese Rara.
Yeah. And the last topic I have for you is for nerves. And there isn't really a lot of medications out there that help regenerate nerves, and nerves regenerate very slowly. But there is a peptide that I came across, and I don't know if you've ever looked into it, but I think it's ARO 290. Are you familiar with that peptide?
I did not research it much because it just I don't think it's very promising. If it would be promising, everybody compounding pharmacies would make it, but they don't. And I think it's very new. We can even ask how new that is. It's pretty new. Just together in another peptide that is anti-cancer, they say something with arrow what? I just want to look
It's
at the mechanism.
ARO 290.
Just want to look at the mechanism. ARO 290. This is erythropoietin. Okay. But this is so this peptide derived from erythropoietin. So this is it should not be no, this is not nerve regeneration. This is cardiovascular and thrombosis risks.
Got it. So
The
is there,
nerves would be BPC 157 is one that we have that evidence on the mice that it can
okay.
help with peripheral nervous system regeneration. That's BPC 157. If we're talking about central nervous system, which is your brain, then we go to SS31 because of the mitochondria stabilization of the cardiolipin and regulation of ATP production. And your neurons rely on ATP production.
So with
Cmax
that,
and C-link.
so with that, so what peptides then for the nerve, like for people that have like an overactive sympathetic nervous system, And that could be from just chronic stress, drinking, poor habits,
Oh,
bad sleep.
C-Lank. They should entertain C-Lank. C-Lank is available in every compounding pharmacy via nasal form of formulation, and it's calms you down. It really does.
Yeah. And then Cimax, does that have any impact
C-Max,
on?
C-Max, mostly for ADD.
Right.
C-Lank is anxiolytic. C-Max is it's a different mechanism a little bit, but some people respond to one or another, but people do respond. Some people don't respond to any, but you should try. You
Yeah.
should.
Because,
I mean, it's a safe medication. It's a nasal spray. It's been researched in Russia. I would say, even if it's not FDA approved, it's been used in countries for so many years. You can try it.
yeah, because Solank, I was looking, when I was looking into that, like I mentioned earlier, like it had really good phase two human trials in Russia
Mm,
with really great results. So yeah, I'm just trying to think about because I have a friend that was on like a high dose of Adderall, and now they take Slank and C-Max together,
mm-hmm.
and they said
And
it's much better.
another thing I want to mention, it has nothing to do with peptides. It's the machine that I have in my clinic called ExoMind. Have you heard about that machine?
No, I
It
haven't.
does what it does what psychedelics do without psychedelic effect. It works on neuroplasticity. It increases communication between neurons. It makes new neuronal connections. It activates axons and dendrites. That machine is now FDA approved for major depressive disorder and PTSD. And we
How do you
have a
spell
lot of
it?
people.
Oh, sorry, I thought you were done.
ExoMind, EXO Mind.
Got it. I'm gonna look into that.
You
Got it.
have it
So
in Canada. You have it in Canada. I have a patient who came yesterday and said, I have the same machine in the clinic where I go.
got it. I'll look into that. So Exomine, Solank, Max, like those are things that can help with
Yeah, right,
the nervous system. Okay.
right.
And
For
my
those who are afraid of psychedelics, should entertain ExoMind.
yeah, got it. Yeah, because my thing on yeah, I think like when you're going to go to do something like ibogaine or ayahuasca, you're probably better off trying a few modalities first before going there, maybe. But
Maybe, yeah.
um,
And I do not about I again I'm a proponent of psychedelics, but I'm not proponent of ayahuasca because long exposure to DMT can lead to psychosis. And this is one of the there is a documented side effect with ayahuasca. If you were to try DMT, I would say smoke it, not drink it.
yeah, right. Yeah, I think ibogaine is probably.
Yes, Abigail is it's very long trip though, very long.
I know my friend that was telling me who came back from it. It was he was there for weeks, and
Yeah.
he also said something interesting that he's like you would be shocked at who the people are there because you get there with like you and 12 other people, and he said one of the guys that was there is a pretty well he didn't say his name obviously, but a well-known CEO who's worth like hundreds of millions of dollars who had addictions, a ketamine addiction for like 12 years that went there for it. So
Mm-hmm.
it's not just like drug addicts on the street. It's like I always explain that like drug addicts are usually two sets of people. And one, it's like homeless people in the streets. And the other side of it is extremely high functioning people that had a lot of money and then got into drugs. But because they make so much money, they're able to support their habit, but still